All right, so today we're taking a deep dive into something a little bit unexpected, maybe. We're going to be talking about priapism.
Oh, okay.
I know, not exactly, dinner party conversation,
Right.
but, trust me on this one. It's a condition that's worth understanding. And you've probably heard the term before, but I think a lot of people don't really know, like, what priapism is.
Yeah,
So
yeah, yeah, yeah.
maybe we just start with that, like, what actually is priapism?
Okay. So, well, priapism is basically an erection that persists.
Okay.
And it's often painful too. And importantly, it's not related to sexual stimulation.
Okay. So that's what makes it different from like a regular, I don't know what the right word is.
Right. It's not supposed to be happening.
Yeah, yeah. Interesting. And one of the things that I found in getting ready for this deep dive is that there are different types of priapism.
Yeah, there are actually.
And we have some really good sources to guide us today. We've got guidelines from both the American Urological Association and the European Association of Urology, and then a really good overview from Stab Pearls.
Great sources.
Yeah, so we're going to be kind of, synthesizing information from all three of those.
Hmm.
But yeah, maybe we could start with these different types of priapism. I know that ischemic priapism is like a real medical emergency.
Yeah.
So maybe we could talk about that first, like what makes that one so urgent compared to, some of the other types.
Sure. So the main difference between ischemic and non-ischemic priapism is blood flow. So with ischemic priapism, the arteries that supply blood to the penis are relaxed, but the smooth muscles that usually allow blood to flow out, they become paralyzed.
Oh, wow.
So the blood kind of gets trapped, the pressure builds up, and this can lead to something called compartment syndrome.
Okay, compartment syndrome. Now, I've heard that term before, but I don't really understand what that means in this context.
Sure. So think about when you have like a really tight shoe on
Oh, yeah.
and the pressure builds up and it hurts and it can actually damage your foot.
Right.
Compartment syndrome in the penis is similar. That trapped blood cuts off the circulation and that can actually damage the tissue.
Oh, wow. So that's why it's an emergency, because like
Right.
you could actually have permanent damage.
Exactly. Yeah.
Okay. So that's the really bad one, the ischemic priapism. What about non-ischemic? I know that's not considered an emergency.
Right. Non-ischemic priapism is usually not painful, and that's because the blood is still flowing in and out of the penis.
Okay.
It's just that there's more blood flowing in than usual.
Okay.
So it's not as rigid and it doesn't cause the same kind of damage.
Gotcha. Still sounds pretty uncomfortable though.
It can be, yeah.
Yeah. Okay, well, this is all very interesting. So I guess the next question is like, what actually causes these problems?
Right.
And I was looking through the sources, and there's a surprisingly long list of potential culprits.
Yeah, there are a lot of different things that can cause priapism.
So maybe we could just go through some of the most common ones.
Sure.
One that I know is linked to priapism is sickle cell disease.
Right.
And I know that affects the red blood cells, but I'm not sure I totally understand how that ends up causing priapism.
Sure. So in sickle cell disease, the red blood cells are abnormally shaped. They're kind of like a crescent or a sickle shape, which is where the name comes from.
Oh, okay.
And these sickle-shaped cells can clump together and block blood vessels, especially the small ones.
Okay.
And in the penis, this blockage can lead to priapism.
Gotcha. So it's like a tiny dam forming in the blood vessel.
Exactly, yeah.
Okay. So sickle cell is one potential cause. What else are we looking at here?
Well, certain medications can also cause priapism,
Oh, okay.
and it's not just medications that are used to treat erectile dysfunction, which you might expect.
Right, really?
Yeah. Certain antidepressants, for example, like trazodone,
Yeah.
or some antipsychotics, those can also cause priapism.
Now, remind me, like antidepressants, those are designed to affect serotonin in the brain, right?
That's right, yeah.
To help with like mood regulation and stuff. How does that end up causing an erection?
Well, it's not fully understood, but it seems like serotonin plays a role in the balance of chemicals that control blood flow in the penis.
Interesting.
So even though it's targeting the brain, it can have these unintended effects elsewhere in the body.
Okay. So, always be aware of potential side effects, even if they seem totally unrelated to what the medication is for.
Right, exactly.
Okay, so we've got sickle cell, we've got certain medications. What else can kind of throw a wrench in things down there?
Well, recreational drugs can also be a trigger for priapism.
Okay. Like what kind of recreational drugs are we talking
Well,
about?
alcohol, marijuana, cocaine, those are some of the more common ones.
Okay, yeah, that's quite the lineup. What about physical trauma?
Oh, yeah. That's another big one.
I imagine that that's kind of a more straightforward cause, right?
Yeah. Yeah. So any injury to the genitals or the perineum, which is the area between the anus and the scrotum,
Right.
anything that disrupts the blood flow in that area could lead to priapism.
Gotcha. So like a direct blow or something.
Exactly. Yeah. Or a straddle injury, even a pelvic fracture.
Wow. Okay. So we've got the diseases, medications, drugs,
Yeah.
injuries. But then the sources also mention some less obvious culprits like metabolic disorders and neurological issues
Mhm.
and even tumors.
Right. Yeah.
So how do those play into it?
Well, so metabolic disorders like gout and amyloidosis, they can affect blood flow throughout the body.
Okay.
And then neurological disorders like spinal cord injuries and strokes, they can disrupt the nerve signals that control erections.
Gotcha.
And then tumors, either through direct invasion or metastasis, can also affect the blood vessels and nerves in the area.
Wow. So it's pretty complex. There's a lot of different ways things can go wrong, it seems.
It is, yeah.
Okay. So let's say someone, suspects they might be experiencing priapism.
What happens next? Like, how do doctors diagnose this?
Okay, so the first step is a detailed history.
Okay.
So the doctor will want to know how long the erection has been going on, if it's happened before, what medications the patient is taking, any drug use, any history of trauma,
Makes sense.
just to try to figure out what might be causing it.
Gather all the clues.
Exactly.
Okay, what about like a physical exam? What are they looking for there?
Yeah, so a physical exam is also important to check for any signs of trauma or other underlying conditions.
Okay.
Like if there's any swelling or tenderness,
Yeah.
things like that.
Now, one thing that stood out to me in the guidelines is the importance of aspirating blood from the corpora cavernosa.
Mm-hmm.
Now, why is that so important?
So aspirating the blood allows the doctor to analyze the blood gases, like the oxygen, carbon dioxide, and the pH levels.
Okay.
And that helps differentiate between ischemic priapism and non-ischemic priapism. Okay, so it's like a blood test, but specifically for the blood that's trapped in the penis.
Exactly. Yeah. And that's really important because it guides the treatment.
Okay, so you want to make sure you're treating the right type of priapism.
Right.
And the guidelines really stress that even if further tests are needed, like blood work or imaging, that those shouldn't delay the treatment for ischemic priapism.
Absolutely. Yeah.
That's the one where time is of the essence.
Exactly. The longer that blood flow is restricted, the greater the risk of damage.
Okay, so let's talk about treatment then.
Sure.
What's the game plan for tackling this?
So for ischemic priapism, the treatment is really a ladder.
Okay.
You start with the least invasive approach and you escalate as needed.
Okay.
The first step is usually aspiration and irrigation.
Okay, so you're literally drawing out the stagnant blood and then flushing the area with saline solution.
Exactly, yeah.
Okay. Doesn't sound very pleasant, but I guess it's effective.
It can be, yeah.
And if that doesn't do the trick, what's the next step?
So the next step would be to inject a medication called a sympathomimetic drug,
Okay.
usually phenylephrine, directly into the corpora cavernosa.
And what does that medication do?
It constricts the blood vessels,
Oh, okay.
so it reduces the blood flow and hopefully reverses the priapism.
Gotcha. And if that doesn't work?
Then surgery may be necessary.
Oh, wow. Okay, so what kind of surgery are we talking about here?
So the goal of the surgery is to create a shunt,
Okay.
which is basically like a bypass,
Okay.
to redirect the blood flow and relieve the pressure.
Gotcha. So it's a pretty serious situation.
It can be, yeah.
Okay. Well, this is a lot to absorb. Why don't we take a quick break, and then when we come back, we can talk about another type of priapism that I found particularly interesting, called stuttering priapism.
Sure, sounds good. Okay, so you mentioned stuttering priapism.
Yeah, stuttering priapism. It's it sounds kind of scary, honestly.
Yeah, it can be.
So what exactly are we talking about here?
So stuttering priapism is also known as recurrent priapism. And as you might guess, it's characterized by repeated episodes of priapism.
Okay. And are these the same kind of like painful erections that we were talking about with ischemic priapism?
Yeah, often they are painful, and they're often short-lived, but they can happen over and over again.
And the sources mentioned that this often happens at night.
Yeah, that's right.
Oh man, that sounds like a recipe for sleep deprivation.
It can be very disruptive, yeah.
Yeah. So is this linked to to any particular causes, or is it still kind of a mystery?
Well, we don't fully understand what causes stuttering priapism, but it's often associated with sickle cell disease.
Okay, right, right. So that's one we talked about earlier.
Yeah, and interestingly, cannabis use has also been linked to stuttering priapism.
Oh, wow. I didn't realize that.
Yeah.
So if we don't really know what causes it, how do doctors even begin to treat it?
That's the challenge, right? When you don't know the underlying cause, it's harder to target the treatment.
Hmm.
But generally, the approach is to manage the acute episodes.
Okay.
So when someone's having a stuttering priapism episode, you treat it the same way you would treat ischemic priapism.
Okay. So aspiration, irrigation, maybe medication.
Right, exactly. But then the other challenge is trying to prevent future episodes.
Right, because you don't want it to just keep happening over and over again.
Exactly. And that's where it gets a little more complicated because there's not, one clear solution.
Okay. So what are some of the options that doctors consider for preventing those episodes?
Well, there are a few different medications that can be used. One is baclofen.
Okay.
That's a muscle relaxant that can also affect nerve signaling.
Okay.
Another option is finasteride.
Okay.
That's a drug that blocks the production of a certain hormone.
Okay.
And then, believe it or not, sildenafil can also be used.
Wait, sildenafil, that's like Viagra, right?
Yeah, exactly.
That's usually used to help men get an erection.
Right. But in some cases, it can actually help to regulate the smooth muscle tone in the penis and prevent these unwanted erections.
Wow, that's fascinating.
It is.
So it's kind of counterintuitive, but it makes sense when you think about how it's actually working.
Right. And then, of course, for people with sickle cell disease, hydroxyurea is often used to manage the underlying condition,
Right.
which can also help to reduce the frequency of priapism episodes.
Okay. So it sounds like, finding the right treatment for each patient is really an individual process.
It is, yeah. It's
Yeah.
about weighing the potential benefits and risks of each option.
All right. And really working closely with the patient to figure out what's best for them.
Exactly, yeah. It's shared decision-making.
Okay. So we've talked about the different types of priapism. We've talked about some of the causes. We've talked about treatment. I'm curious about the long-term outlook for men who experience priapism. Like what factors determine their prognosis?
Well, one of the biggest factors is the duration of the erection. So the longer the erection lasts, the higher the risk of damage.
Okay, makes sense.
The underlying condition is also important.
Okay.
So, for example, if someone has sickle cell disease, they may be more likely to have complications.
Right.
And then the patient's overall health and age also play a role.
Okay, so it's a lot to consider.
Yeah.
And there's no easy answer.
Yeah.
But is there any good news here?
Well, the good news is that with prompt and appropriate treatment, many men can avoid long-term erectile dysfunction.
Oh, okay, that's good to hear.
Yeah, so early intervention is really key.
Right. So if you think you might be experiencing priapism, don't wait. Don't try to tough it out. Just get to a doctor.
Absolutely, yeah. It could make all the difference.
Okay. Well, this has been really informative. I think it's amazing how much research is being done in this area.
Yeah, it's an active area of research.
And it's encouraging to know that there's hope for men who are dealing with this condition.
Definitely, huh?
Okay. Well, I think we've covered a lot of ground here. But before we wrap up, I want to circle back to something that we touched on earlier, which is managing priapism in sickle cell disease patients.
Okay.
I found that particularly interesting because it seems like there are some specific considerations for this population.
Yeah, definitely. So, as we talked about before, sickle cell disease is a common cause of priapism, particularly the stuttering type.
Right.
So, managing the underlying sickle cell disease is really important.
Okay.
And that might involve medications like hydroxyurea, which can help reduce the frequency of sickle cell crises, including priapism episodes.
Okay, so it's kind of a two-pronged approach.
Yeah.
You're addressing the immediate priapism episode, but you're also working to prevent future episodes by managing the sickle cell disease.
Exactly, yeah. And for sickle cell patients who are having an acute priapism episode, the guidelines recommend considering an exchange transfusion.
Okay. Now, remind me, what is an exchange transfusion again?
So an exchange transfusion is basically where you replace the patient's blood with donor blood.
Okay.
And that can help to quickly reduce the concentration of sickle cells in the blood, which can help to resolve the priapism.
Gotcha, gotcha. So it's like a more aggressive form of blood transfusion.
Yeah, you could think of it that way.
Okay, okay. So it's really interesting how everything is interconnected,
It is, yeah.
managing the sickle cell disease, addressing the acute priapism, and then also thinking about long-term preventative strategies.
Right, it's all part of the same picture.
Okay.
Ah,
Well, let's move on now and talk about another aspect of priapism that I found particularly interesting, which is priapism that's triggered by medications.
okay, sure.
Okay, so we were talking about how even medications can sometimes be a trigger for priapism.
Yeah, and what's really interesting is it's not just the drugs that are meant for, erectile dysfunction.
Right, right.
It can be medications that are prescribed for completely different reasons.
Yeah, and the sources actually list a few different classes of medications that are known to be potential culprits.
Yeah, one of the more common ones is antidepressants.
Okay.
Specifically, SSRIs, those are the selective serotonin reuptake inhibitors.
Okay.
Prozac, Zoloft, Paxil, those sorts of drugs.
Right. Those are really common.
Yeah.
But I'm having trouble wrapping my head around like how an antidepressant could lead to priapism.
Yeah, it is kind of strange.
Because, they're targeting serotonin in the brain to help with mood regulation. So what's the connection to, what's going on, well, down there?
Well, the exact mechanism isn't totally clear, but it seems like there's some kind of interplay between serotonin and the chemicals that control blood flow in the penis.
Okay, so even though it's targeting the brain, it can have these unintended effects elsewhere in the body.
Exactly. Yeah.
Interesting. So SSRIs are on the list. What other medications do we need to be aware of?
Antipsychotics.
Okay.
The drugs that are used to treat things like schizophrenia and bipolar disorder,
Right.
those can sometimes cause priapism.
And even some medications for high blood pressure, I think.
Yeah, that's right. Which seems a little counterintuitive, right?
Yeah, because I would think that medications that are meant to like relax blood vessels would actually make priapism less likely.
Right, but you have to remember that priapism isn't just about blood flowing in.
Right.
It's also about blood flowing out.
Oh, okay.
And some
Yeah.
blood pressure medications can actually interfere with that outflow.
Gotcha. So it's all about balance.
Exactly.
Interesting. Now, we spent a lot of time talking about ischemic priapism, the one that's a medical emergency.
Right.
But what about priapism that's induced by medications? Is it always the ischemic type?
No, not necessarily. A lot of cases of medication-induced priapism are ischemic, but some medications can actually cause the non-ischemic type as well.
Okay, so again, it's not one size fits all.
Right.
You have to really evaluate each case individually.
Exactly. Yep.
Okay, so how do doctors typically approach managing priapism when it's specifically caused by medication?
Well, it usually involves a two-pronged approach.
Yeah.
So first, you address the immediate priapism episode,
Okay.
using the strategies we talked about before, like aspiration and irrigation or medication.
Right.
But then you also have to think about the patient's medication regimen.
Okay.
So you might work with the prescribing doctor to see if there are alternative medications.
Right.
Or if the dosage can be adjusted.
Gotcha.
Or maybe even if the medication can be stopped altogether.
Okay, so it's really a team effort.
Yeah.
The patient, their primary care doctor, and then the specialist who's managing the priapism.
Right. It's about communication and collaboration.
Yeah. Okay, I have to ask about the elephant in the room, which is medications that are specifically for erectile dysfunction.
Right.
Ironically, those can also cause priapism.
They can, yeah. It's kind of a case of too much of a good thing, I guess.
Yeah.
So, drugs like Viagra, Cialis, Levitra,
Right.
they work really well for a lot of men.
Right.
But they can also, in some cases, lead to priapism.
So even though these medications are generally considered safe when they're used appropriately, it's still important to be aware of the potential side effects.
Absolutely, yeah. And to seek medical attention if something seems off.
Yeah. What's the guidance if someone experiences a prolonged erection after taking one of these medications?
So the guidelines say that any erection that lasts for more than 4 hours, especially after taking one of these medications, needs immediate medical attention.
Okay, so don't wait. Don't try to tough it out.
Nope, get to a doctor right away.
Okay. Well, I think, this whole deep dive has really been eye-opening for me. I learned a lot about priapism that I didn't know before.
Me too,
Yeah.
yeah. It's a really fascinating condition.
It is, and it's really encouraging to know that there's so much research being done in this area and that there's hope for men who are dealing with this condition.
Absolutely.
So thank you to everyone for listening to this deep dive on priapism. We hope you learned something new, and we encourage you to check out the sources that we use for this episode if you want to learn more.
And remember, if you're experiencing any of the symptoms we talked about, please don't hesitate to reach out to a healthcare professional.
That's right. Early intervention is key. Thanks again for listening, and we'll see you next time.